All right. Hello and welcome everyone to today's webinar. I'm so glad to have you here today. Good morning to most and good afternoon to some. I am so happy to be partnering with Greater Seattle Partners to bring you today's webinar. My name is Betsy Page. I'm the Events and Programs Manager at the Seattle Metro Chamber. We have a great panel. We want to go ahead and get started, but really quickly, just wanted to share some general housekeeping for today's webinar. Please note that all attendees are muted, but we would like some audience participation. So later on in this session, we will have time for Q&A. If you notice, Zoom has a Q&A box at the bottom of your screen, so you can submit questions that way. You should be able to just type in your questions, and we will read those aloud during the Q&A at the end of our section. If you have any issues accessing that, please feel free to chat me. There's a chat function in Zoom as well, or you can email me. My email is on the bottom of the screen as well. So that is all of our housekeeping for today. Without further ado, I would like to introduce today's moderator, Dr. Gary Kaplan. Gary Kaplan has served as chairman and CEO of the Virginia Mason Health System in Seattle since 2000. He is also a practicing internal medicine physician at Virginia Mason. He completed his internal medicine residency at Virginia Mason and served as chief resident in 1980 and 1981. He is a fellow of the American College of Physicians, the American College of Medical Practice Executives, and the American College of Physician Executives. He's recognized as one of the most influential physician executives in healthcare. Wow. So with that, I'd like to welcome Dr. Gary Kaplan.
Oh, thank you. Thanks, Betsy, and welcome to all of you. Thanks for joining us for today's virtual International Leadership Mission Exchange in Dublin and Toronto. I want to start by thanking our sponsor, Alaska Airlines. Thank you to this great company. As Betsy said, I'm Dr. Gary Kaplan, and in addition to my day job, I've also had the pleasure of being very involved in the Seattle Chamber and have served as chair of the Greater Seattle Metropolitan Chamber several years ago, and really appreciate the great work the Chamber does in helping us all stay connected and focused on our business community. I know many of you had an opportunity to take advantage of Tuesday's virtual exchange where we heard from leaders from Seoul and Hong Kong. So thank you for attending today's second session, and particularly want to welcome back Rachel Smith, our King County Deputy Executive, for this second session. As many of you know, the Seattle Metro Chamber plans an annual trip every year for Seattle executives. This is called our International Leadership Mission. This week, our delegation was set to be in Munich, Germany, and obviously for good reasons, there was a change of plans. Reports of coronavirus or COVID-19 began circulating in December 2019 in Wuhan, China. And by mid-March in Washington State, we already had several fatalities, and the state began to prepare for our stay-at-home order, with a majority of other states soon following suit. The coronavirus has now spread to over 190 countries and has changed life as we know it. The Congressional Research Service estimates that the virus could trim global economic growth by as much as 2% per month as it continues, and could cause global trade to fall by as much as 13%. Here in the United States, as many of you know, we have close to a 15% unemployment rate already, and that is likely to increase. So today we'll hear from 4 global leaders on the impact COVID-19 is having on their regions, how they are problem solving, how they are meeting this challenge, and what the future will look like on the other side of the crisis. So let's get started, and please help me welcome our panelists. I'm going to introduce them to you, let me start with the Honorable Megan Grigonis. Megan Grigonis is the United States Consul General in Munich. You see her picture up there on the screen, and she will be joining us by phone. She's served in the United States Consul role in Munich since July of 2018. Before her assignment in Germany, she was Deputy Director for Public diplomacy in the State Department's Bureau of European and Eurasian Affairs, where she oversaw and broadened public diplomacy engagement in Western Europe. In this capacity, she also coordinated U.S. efforts to counter disinformation, something I think we are all quite concerned about. Next, I'd like to introduce the Honorable Robert O'Driscoll. Robert took up duty as Consul General of Ireland to the Western United States, based in San Francisco in July of 2017. He was born in Dublin, joined the Irish Department of Foreign Affairs in October 2007 as a third secretary. Robert previously served overseas in Ireland's permanent representation to the EU in Brussels 2012, as deputy head of mission in Ireland's embassy to the United Arab Emirates from 2009 to 2011, and in Ireland's embassy to Saudi Arabia from 2008 to 2009. Next, I'd like to reintroduce Rachel Smith, our deputy King County executive. She's responsible for administration of the executive staff, as well as directing strategic initiatives, external and internal policy coordination, intergovernmental relations, and communications. Rachel previously served as Director of Government Relations in the Executive Office and has nearly 15 years of government affairs, policy, and advocacy experience, including various positions at Sound Transit here in our region and serving in the administration of Seattle Mayor Greg Nichols. And last, I'd like to introduce Lee Smout. Lee is Executive Director of the World Trade Center in Toronto, and as Executive Director, he is responsible for planning, developing, and implementing the World Trade Center's business plan. He's an experienced president, CFO, and COO in both public and private sectors, with an interest in opportunities to grow or transform products, services, organizations, or programs. So welcome again to all of our panelists. Thanks for carving out some time to be with all of us on this webinar. And let's start first with having each of you take 2 or 3 minutes to tell us what's happening in your regions and countries right now during the COVID-19 crisis. What has the evolution of the pandemic been like where you are located, and where are you, or who you represent, and where are you currently in the process? Are you getting ready to reopen, or are you still in kind of recovery mode? So let's begin with Robert, and then we'll hear from Megan, Lee, and then we'll end with Rachel to compare it to our region here in Seattle. So Robert, why don't you get us started?
Thank you very much, Dr. Kaplan, for having me on today. And before we begin, I also want to thank the Seattle Metro Chamber for having me here, and also just to pay my condolences to everyone in Washington State who's been affected by this awful disease. I mean, the numbers are the numbers, but there's a human story behind each one of them, I think, which is something we'll have to come back to later on as we grieve, as we can do after this. So I'm going to pay my condolences. So I think in the Irish context, our first case was on the 29th of February in Ireland, and quite quickly it became clear that it was going to rise, and the peak in Ireland was probably mid-April, where we hit about 657 cases per day. We're now down to about 150 cases new each day. That's an additional rate of less than 1% per day over the last week. So I think we can say that we've successfully flattened the curve. In terms of the number of deaths, it's just under 1,500 people have died in Ireland. 90% of those people have been over the age of 65, and most of them have had underlying conditions. And as I said, like, there is a human story behind all those cases. We've about 23,500 cases in total so far in Ireland. And when we look at our response, I think that, it was quite interesting because obviously this all happened around St. Patrick's Day. So this is our busiest time of the year. This for us is our Christmas. We're like Santa at Christmas at that time of the year. And our Prime Minister, our Taoiseach, was actually in Washington, D.C., staying in Blair House. So he announced our stay-at-home order from the steps of Blair House. And that was on the 12th of March. And really, the compliance level has been very good in Ireland. People have been responsible. People have taken the public health advice. And we've been very happy that it's managed to, everyone working together has managed to flatten that curve. We are now looking to reopen, and next Monday, the 18th of May, we will start that process, moving into our first phase of our reopening. It's a 5-stage reopening process that we believe will, the 5th stage will be in the middle of August. But as we're saying to everybody, you know, these dates are indicative. Really, the public health data is driving the decisions in Ireland about how we reopen. So these are indicative dates. I think they're important in terms of people being aware of a general sense of what the endpoint looks like. But really, all of our decision making has been very much data driven.
Great. Thank you very much, Robert. Megan, let's turn to you.
Yeah, thanks a lot, Dr. Kaplan, and it's a real pleasure to be with the group today. I'd like to join my diplomatic colleague, Robert, in just extending my thoughts to those who have really suffered in Washington and the greater Seattle region. This has been a very difficult situation for us all, and I know that you guys have been particularly hard hit. Here in Germany, I'd like to say that the Germans have had a rather successful approach to COVID-19. I'm here in Munich in the south of Germany, and this is where we had our first confirmed case in Germany back on January 27th. By the middle of March, the whole country was closed down. Germany has a federal system, so each of the different states in Germany had a different approach, similar to our U.S. approach, with the states really taking the lead. But Chancellor Merkel called this the greatest challenge since World War II, and I think that really is true. Things have started to reopen here in Germany, but again, it's a state-by-state effort. And here in Bavaria, we've got the schools starting to reopen. Stores are open. Restaurants will start opening on Monday. Hotels will start opening by the end of the month. But the borders are still closed. There's very little travel between Germany and other parts of Europe. And certainly travel has been interrupted between Germany and the United States. Here in Germany, the response has really been quite effective in flattening the curve. There have been about 8,000 deaths so far, 170,000 cases, and there has been a really good organized response to expanding the intensive care unit capacity, for example. They've expanded that capacity by using hotels, and they've had a lot of creative ways of engaging industry to get industry to make more of the protective gear, to re-gear operations, to make the disinfection agents that are required. A big challenge for Germany will be maintaining the gains moving forward. So there's ongoing discussions similar to in the United States. What is the right pace for reopening things? We saw a demonstration here in Munich over the weekend, and we expect some more demonstrations in the future because the economy would like to accelerate the pace that things are opening. Here, I'm the United States representative here in Bavaria, a real economic heartland of Germany. We did not close, and a lot of businesses have remained open, although they've been respecting a number of social distancing regulations. So we've actually changed the way we're working in terms of we continue to provide support for Americans. There's been a lot of requests for support for American businesses. For example, we've been working with them in an effort to potentially find opportunities. The regular way of business has completely changed for us, and we're providing a lot of humanitarian support. So a lot of American citizens needed to get back to the United States, and they transited through Germany. So we provided assistance for thousands of Americans coming through Germany, and we've provided a lot of humanitarian assistance for folks as well. I think that I will stop there, and there's lots more to talk about as we move forward. So back to you, Dr. Kaplan.
Great. Thank you, Megan, very much. Lee, tell us what's going on in Toronto.
Yeah, well, Canada generally has had a similar response, I think, to across the world. And we, of course, we're quite a spread out country, and we have a number of provinces, and specifically in Ontario, which is the province that Toronto is in, I think as of yesterday, our total number of cases is about 20,000, 21,000. And that was, we're adding about still around a little over 300 cases per day, but that is a very flat number. It's been maybe a little bit trending down. And so because of that, we've started to reopen some things. And so some of at the extent of closures, things like hardware stores and so on, they were closed. And the only thing you could do was do some curbside pickup, which has been really challenging. I know personally, I've tried to get some things and sometimes it's 3 to 5 days to be able to pick up some little supply you need. And but the really critical things, the grocery stores and so on, have remained open with social distancing in place, and it's been pretty effective. There hasn't been a really big trend towards the use of masks and things until quite recently. But I think that has sort of as the community has started to get out a little bit more, as things are opening a little bit, and I think the most recent thing today is that any store, no matter what they sell, if they have a curbside entrance, is going to be able to open, keeping all the distancing and so on in place. And as that has started to happen, people have started to trend a little bit more to the masks and things. And certainly people have been great about using their hand sanitizer and so on. I personally live in an area, Toronto, called the Beach. We have a very lovely boardwalk along the beach, and I try to run a few days a week, and people have been just great down there in terms of small family groups of 2s or 3s or whatever it might be together, but otherwise everybody's doing a great job of keeping apart, keeping active a little bit, trying to stay healthy. And we had a lot, I think, to learn from things like SARS and so on. We'll probably talk about that a bit later. That's kind of led to the community response. But I have to say, my view is it's been pretty good. But the challenge I'm seeing right now is things like the school system. We are not at a place where the provinces run the schools where they feel like they can open them at all this year. And then now we're hearing from universities. I have a university-age daughter who's about to go in September, and she will probably not be going. We're starting to hear from one university after the other that they're going to have to be online even in September. And so there's a lot of concerns about the sort of long-term impacts of this, especially on the economy, as some of those things can open more, especially in tourism, travel tourism, events, food services, that kind of thing.
Great, thanks very much, Lee. Rachel, thoughts on what you've heard and how we're doing here in King County?
Yeah, thank you again for having me today. It is always a pleasure to be here with folks from the Chamber and with partners from around the globe. I think similar themes. So I would say I would characterize where we are here in Washington State as flattening the curve, but not out of the woods yet. And obviously here in King County, the economic engine of Washington State, our situation is unique. We are still statewide under a stay-at-home order, and we are still we are still sort of in the regular cadence of taking additional actions to manage the disease. So for example, we just recently did a public health directive for individuals to be wearing masks when they're in public settings. So we're still in sort of that cadence. That being said, we are looking at reopening. The governor of the state of Washington has identified 4 phases for doing that. But a couple of things I would note. It's sort of in the King County uniqueness space. I think there's 2 things of note. One, because we are the economic engine, how we reopen is necessarily going to be more granular, I think, and nuanced than the state that's at kind of the 30,000 foot level. We are totally aligned with that work, but nowhere else in the state has the number of museums and zoos and aquariums that we have here. Nowhere else in the state has the number of convention centers and other gathering types of places, sports teams and things like that, global tech hubs, et cetera. So how we really keep people safe as we reopen in this sort of dense and huge amount of economic activity is unique. And secondarily, our experience with the disease in King County is unique. We have had the most cases, we have had the most deaths, we have had the most devastation, and we were frankly the epicenter of the outbreak in the United States. And so, we, I think, our public health folks had been prepared for something like this. But that being said, there was no roadmap or other here in the US, sort of roadmap to look at. So we have been looking at much of the work that you all have been doing to help us guide the work that we have done. And we have saved lives, our cases are reduced. Dr. Kaplan and I were just talking before this that our hospitals remain intact. And so those are some of the really critical things that, are the underpinnings of our ability to reopen as we go forward. So in that way, I think, we've been successful. The last thing I will just say, because I must, is the community of King County has been just exceptional in terms of their willingness. And Lee, you mentioned this as well for your community, their willingness to take public health directives, to, adhere to guidance, and to be we're all in this together. And I can't underscore how important that is for government officials to be able to get the kind of policy outcomes that we're looking for.
Thank you. Thanks to each of you for those introductory comments. I want to hone in on a little bit more specificity to each of you, particularly around how your community and your citizens are reacting to the business closures, the stay-at-home instructions, travel restrictions. Maybe we'll start with Lee. And as you mentioned, Toronto's already had experience dealing with pandemic, in 2003 with SARS. Can you just tell us a little bit about how that experience has shaped the response now? Were there some lessons that you've been able to apply the learnings this time around? And are there some obvious lessons now from this that you'll take forward?
Yes, thank you, Gary. It's one of these fascinating things that SARS has had a big influence on the country's health system, I think, over the last, it's been 17 years since SARS hit. And at the same time, none, because what happens is you tend to forget about these things and put them behind you. So while the health community may have been affected and was building systems and processes, the people tend to forget. And so, however, I do think we were quickly reminded of SARS when the coronavirus first broke, and I do think it's probably led to a willingness among the community, most people in the community, or certainly a quicker description of the challenges and the possibilities of avoiding challenges that the history with SARS had created for us. And so, in particular, and this is one of the challenges, again, with Canada being a big, wide country with not that many people, in some places we did better than others. And so the one fascinating thing is that the person in charge of health in the Vancouver region, she knew right away that we could not have workers working in one extended healthcare facility moving to another, because those people, that community is so vulnerable, and the people that are there are more likely to have it, catch it, and they become, it sort of grows in those communities. And then if you take a healthcare worker from one, you move them to the other, they're very likely or quite possible to be a carrier. And so that's one of the things they changed immediately. In Ontario, it was very difficult for us to mirror that response, because the way the system works here, frankly, a lot of people in healthcare, and especially in extended age care, are not paid that well, and they tend not to have permanent jobs with benefits and so on, and they tend to work part-time in a number of facilities. And so you had to weigh the risk of them carrying that problem from one to another against the risk of not having enough care in a place because you tell them you can only work in one. And so we didn't respond as well, and we had bigger problems in our in those communities here than they did in Vancouver, for instance. But all of that learning in Vancouver and the awareness of it came from that SARS effect. And I think the other thing, just really briefly to mention about SARS, is because it was such an impact in Toronto in particular, there's any number of, and certainly across Canada, but there are any number of folks that were heavily involved in that at the time in healthcare who have really since then been involved in trying to put systems in place that could manage a challenge like this, and including moving to cures. And so there's a Dr. Joseph Penninger who worked at Princess Margaret Hospital in Toronto during the time. He's out in Vancouver, I think now at University of British Columbia, but they have developed essentially they had isolated how SARS got into the human body, and it turns out that it's very similar to the way COVID-19 works. And so they're well down the path of working out how to resolve that problem based on some of the, so I think that a little bit of a head start to help that along has been helpful.
That's great.
I think that's kind of the main things that come out of SARS, really.
Thank you. Some of that mirrors our own experience with regional variation and different exposures in the United States. But what we're finding is even where there were regions of the country that we thought they were home free, now they're just trailing behind, and they're now experiencing their own increases. Megan, Germany's in the slow stages, as you described, of reopening. How do you think that's going? Are you seeing some early successes or any negative impact, anything that makes people or the government want to pull back a little as you begin to reopen?
Yeah, a couple of things I would say is that we're starting to see actually a backlash against the restrictions. So since the middle of March, people have been in kind of a semi-lockdown situation where they haven't been confined 100% to home. So people still have been able to go out, exercise. The parks have actually been very full, but the police have also been underscoring the need to keep the social distancing measures in place. Right now, what we're seeing is that there has been a lot of support for those measures, but now we're seeing people come out to the streets and demonstrate. They want to be opening up the economy more quickly, and that's a really big challenge for the politicians. So we saw 3,000 people come out in Munich this past weekend, and we expect another 10,000 to come out. It's really, this is the economy driving things. We really are seeing a lot of pressure coming from the business community and from some others on both the left and the right sides. But that's a real concern here locally, because the Bavarian government has tried to take a very measured approach. Here in Bavaria, actually, I wanted to mention about SARS. Nobody really thinks about SARS having had an impact here in Europe, but actually in Bavaria, there was a crisis response unit established during that time, and that is what has led the response here in Bavaria. And Bavaria has led the response for all of Germany. Bavaria did have the first case here back in January, but it was also the first to set up a crisis response unit within the Bavarian government, and that has really led the response. And Bavaria has been an early mover and has been actually quite cautious. But now the big question moving forward is how quickly can they move forward, and they're going to need to keep an eye on the infection rates as well, because it's set some limits, and if they go over the limits, they're going to have to pull back some of the loosening that they've done in the past couple of weeks. But for now, things are starting to look normal. People are wearing masks around. People are really respecting those rules. But again, it's a group of folks who are coming out and demonstrating. They want to move back to a more normal situation, which we don't see as happening for several weeks, if not months, into the future.
Right. It seems like there's a responsibility that goes with reopening, that people have to adhere to the guidelines if we want the reopening, however gradual, to be successful. So Robert, I want to cut to the chase. Ireland announced a closure of all pubs until August, with a possibility of reopening earlier. In Washington, we've actually labeled, I think, some of those related shops and bars essential services. How has that been received by your communities? What's it mean for the economy and labor force? That's got some cultural impact, I would imagine, to not be able to go out to the pub.
Yeah, for sure. Absolutely. Look, I think for us, we've had great leadership from the top on this. I mean, I think that's been really interesting. Our Prime Minister, Taoiseach, on the 12th of March, again on St. Patrick's Day, the 17th of March, laid out very clear the need for Irish people to pull together. I mean, I think when you looked at countries that were at risk at the start of this of having significant challenges, look at the number of ventilators, for example, that we have in Ireland, ICU beds, etc. You know, people would have thought that perhaps Ireland was going to be a country that would experience very, very distressing scenes. So there's been a real sense of pulling together in Ireland. There's an Irish term for this called mehel. Essentially, it's where in our rural communities, people would volunteer to help their neighbours to get the harvest done. And that spirit is very much in our society, and it's very much characterised the public's response. And then from a public policy side, I think, which is some important elements, I think, is one, the government put in place a temporary support scheme for employees whereby you can get 70% of your wages up to a maximum of 410 euros per week. And that's to maintain the link between the company and the employee. At the same time, then they've been talking to the banks about not having, say, foreclosures or problems where people, or evictions or that, or people have are being impacted by COVID-19. So you really are seeing all the different aspects of society kind of coming together, and really it's helped bring down, it's helped I think increase people's willingness to comply with the orders that are there. And even the case of publicans, I mean, what's really interesting in that is, you know, a lot of pubs voluntarily closed the weekend before St. Patrick's Day, typically their busiest weekend of the entire year. And they voluntarily closed because they had that sense that this is something that we're all in together, and they weren't for financial gain. They wanted to make sure that people were protected. So I think what you're seeing is that, you know, across Ireland is that people are just mucking in and trying to get through this. And that spirit is something I think I've been very, very proud of. And it's also a spirit we're seeing in our communities all across America. We see in New York, for example, the community there has put together a fund to help those most in need. We're talking to our community partners here about something similar here. So that's really been the main characterization of our response, which is something I said I'm very proud of.
Sounds like a silver lining of people, the social responsibility, people coming together.
Yeah.
Rachel, many people are talking about a second wave of cases here and around the world potentially. Do you have some sense of how we're preparing for that, and how we can prepare our communities for this? Because I think there's a tendency to get confident as we flatten and get closer to no new cases, but I think that may be the calm before the storm. So what are your thoughts on that?
Yeah, and that is sort of consuming our thoughts right now, as I'm sure you can imagine. So as we look at the myriad of things that contribute to both the disease's prevalence and spread and our ability to manage it, I think, you know, we are really kind of honing in on, I'd say, 5 key things, and they're both public health and policy informed. The first is the data, and I think in Washington State and in King County, we've done a very good job of getting data out and making it clear to the public, but I think we need to double down on that. And so what we're really going to be looking to do is put out some very clear metrics, and the state has done this in terms of some dials and dashboards, but for King County, again, with our unique relationship to the disease here, some really clear metrics that the public can take ownership over and understand that as those things move around what we would call a trigger point or something like that, that their activity is what is contributing to that and their behavior. And so really trying to use data as a tool to help the public understand that their actions have consequences. Second is what I think we would call kind of the best practices or criteria, public health guidance for reopening and gatherings and general behavior. We have a lot of that material out and available already. The state of Washington is also doing a lot, the CDC nationally, but really pushing that out, getting people familiar and comfortable with it. The third is what I guess I would sort of characterize as supplies. So ensuring that we have the kinds of masks and hand sanitizers and temperature takers and that kind of thing, and how do we get an understanding of how much of that this community will need, and then how do we use the buying power and the sort of heft of both our own government, but also all of our business partners who have been exceptional in this crisis to bring that material into this community. Fourth is contact tracing. So I think folks are very familiar that when you begin to sort of stop the extreme social distancing, you need to really enhance contact tracing so that you can get in there, understand who's been exposed, and get people isolated and quarantined. And then fifth, and I think Lee, you had mentioned this as well, sort of the vulnerable population. So those living in long-term care facilities, detention facilities, people experiencing homelessness. Government is still the place where we need to continue to support those individuals with infection control and testing and that kind of thing. So those are where we're going to be kind of keeping our eyes. And I can quote my own executive who has said repeatedly, this needs to be a one-way trip. When we have shut so much down, it needs to be a one-way trip to reopening back up. And so we are going to be using our best science, our best caution, and our best judgment to take our steps going forward.
Thank you. That's helpful. That reminds me of a saying that we use here at Virginia Mason. Sometimes you have to go slow to go fast.
Right.
And we certainly do not want to reopen too soon, too fully, and then have to backtrack. And that would be even worse for the economy. I do want to talk briefly about trade and supply chain impacts. You mentioned that, Rachel, but from our international participants, what's been happening? What's the supply chain look like? Will we have enough? Do we have enough PPE? How are you approaching that? And how do we ensure that our stockpiles or our what I would call just-in-case inventory is adequate to allow us to meet the needs that we really may not fully be able to anticipate at the present time? So thoughts on that? Robert, do you have thoughts on that? Do you have them on the supply chain?
Yeah, I mean, obviously Ireland is a massive producer of ventilators. I think we're one of the biggest in the world. And actually, we've been very happy that we've managed to maintain those supply chains throughout this. We've facilitated cargo flights, of course, in and out, particularly to the US. And I think Ireland has really proved its bona fides as a partner in US supply chains over the last number of weeks. I think I was very interested to see the article this week in the Financial Times by the EU Trade Commissioner, Phil Hogan, who was talking about a proposal he made to Robert Lighthizer around the US and the European Union developing common stockpiles. I think those types of initiatives will be needed in the future. I think they're important. I think the more we can try and collaborate around those supply chains and those stockpiles, means it's hugely mutually beneficial. And I really hope that's kind of the direction of travel that takes over the next while. But for sure, I mean, I think on your point on PPE, that has been a challenge. It's been a challenge everywhere. We have worked with Aer Lingus, who, as you know, normally in peace times have a direct flight between Seattle and Dublin to bring large numbers of PPE gear from China into Ireland. I think as we get past this, there'll be a sense of people trying to reevaluate what's made where and how we might secure those supply chains a little bit further in the future.
Thank you. Megan, do you have some thoughts on the PPE issues and supply chain work in Germany?
Yeah, I think I'd like to add, on top of what Robert said, just about the quality control of the PPE. So there was a huge effort to get more PPE into Germany. I think that they did a really good job. But one of the challenges that they found is that a lot of the PPE that was coming out of China did not meet the quality standards. And I think that is a big concern for us in the United States, for our European partners. And that's an issue that will definitely need to be addressed moving forward. The Germans, I think, have done a very good job of getting the PPE in, distributing it to the areas that need it. But these are the big outstanding questions that are going to need to be addressed. Another thing that Germany did very well is they had a number of industries retool to produce the PPE that was in demand. A number of companies across the board, including the auto manufacturers and the auto industry, is a really important part of Bavaria's economy. They were able to retool to make either ventilator parts or ventilators, for example, and produce other protective gear. So that was really positive. But I think that these are big issues that the politicians are going to need to be addressing moving forward.
Thank you. Finally, Lee, I'm curious what's happening in Canada. Are we actually collaborating, or is it every country or every province for themselves here?
You know, honestly, the interesting thing is it's been a bit of both, what's going to be fascinating is what does this portend for the future? You know, there's an example of some 3M face masks that were being in shipment to Canada that the U.S. stopped. And so these are the kinds of things that I think we're going to have to try to solve. I have to say, from a PPE perspective, while there was a couple of weeks of incredible stress over whether things were going to be in place, and there certainly weren't enough masks and things in the initial days, most of that seems to have been resolved partly through community effort, because people are actually making masks. So the ones that we all wear if we go out to a grocery store or whatever are mostly made on the, the dining room table or whatever, sewing machines that have the rust has been scraped off. But in terms of supply chain for those really important things, I think this is a turning point in a way, because I think what we have to start, I read something really interesting in the Economist Intelligence Unit this week. There's a lot of people taking a look at this, and the challenge is, if you have a country like China, you're so dependent on it for your supply chains, and we all are, including automotive, which was just mentioned. And then they close the border, they turn it off, they make a decision, they need things for themselves, whatever, they retool to take care of themselves, and you don't get your product anymore. It affects everything. And so most companies, I think, are taking a look at how they can regionalize their supply chains. And I think that's going to be the result of what's going on here, that regionalization. And what it might be is we test our agreements between favored or trusted countries, for instance, that we can work together with. And, we have a free trade agreement between us and the US and Mexico, of course. We have free trade agreements with Europe and so on. But I don't think, and although they were considered to be progressive and so on at the time, did they ever really, and some of them actually have literally a pandemic clauses in them, but I guess, did they ever envision this problem of us not selling to our neighbors because we thought we might need to hang on to something for our own safety? And so I think we are actually going to have to address this in a big global, from a big global perspective.
I think that's a common theme I'm hearing from all of you, and not to get too political, but I'm not sure that all of our political leaders are always thinking the ways that we're thinking about these things. But it sounds like, in addition to international and partner collaboration, we also will be insourcing to some extent. I know we've repurposed Ford Motor Company, for example. We've received ventilators here at Virginia Mason that were made by automobile manufacturers. And so that's, I think, an approach that will reduce the dependence that we've all had on China for these things. One of the things that we've seen, and some of you have alluded to this, are public-private partnerships, and how the public sector and the private sector are working together. Rachel, you started to mention and talked a little bit about the amazing response from our community. Could you elaborate a little bit on that, and then maybe our other panelists might comment on how the public and private sectors are working together during this challenge?
Absolutely. I mean, I think when you look at the bright spots, that have come from how we have all been responding here in King County and in Washington State, the public-private partnership is absolutely one of those bright spots. And when you think about public-private partnership, it means different things to different people. And if you're thinking about it like in an infrastructure project delivery, it means one thing. Versus sort of a less formal. And I think we're seeing across the board outstanding partnerships. So all of our major companies here in King County have pulled together. They meet regularly. They invite us as government to regularly be briefing them talking about what we're working on. They're providing input. They're also even generating product. So for example, one of our groups called Challenge Seattle, they brought on some consultants to help really hone some guidance, some public health guidance that can be made available to all of our businesses, which our public health officer said, you know, 2 thumbs way up, this looks great after a lot of consultation. So that's just work we don't have to do now at King County in our public health department. And so I just think it has been phenomenal. The open lines of communication, the willingness to share best practices. I will even say for our own enterprise here at King County, I mean, we're a business of 16,000 employees, and being able to talk to Starbucks and Microsoft, who have had experience in the both shutdown space and reopening space across the globe, has been hugely helpful for our own operations. So, you know, I have always felt like, for the most part, a lot of our regional and state government have a great relationship with business here, but it has just been exceptional.
Yeah, it's the collaboration that we've seen here in this part of the world has been amazing. Even in the healthcare sector, where I've had more conversations with competitor CEOs in the last 2 months than I'd had in the last 10 years. And I think that's a good thing. That helps us all raise all boats and learn from each other. How's that being approached in Ireland, Robert? Any comments on that? Private sectors?
Yeah, I mean, of course, our businesses have been under a lot of pressure, and I think a lot of them have been focusing on what next steps look like. I think we put together a huge package of supports to enable them to survive this and to come out the other side, which has been really important. I think one of the areas where we're seeing best collaboration is on the research agenda. So Science Foundation Ireland, which is Ireland's research body, it'd be equivalent to your own national, what's it called? The national, sorry,
National.
come back to me. Yeah, of course. Yeah. They've done a huge. They very early went with a call for proposals around looking for collaborations between researchers, between industry and businesses more generally that tackle COVID-19. And there's been a huge response to that, both from academics and from businesses. And they're doing matchmaking also between businesses and the researchers to try and find innovative solutions. And so the first 5 of those that we've approved, I think, went out were announced last week, and there's hopefully more in train on that. So I think that's a very clear and a place where there is that collaboration and where there is hopefully a benefit coming later on down the line.
Thank you. And Lee, thoughts you want to add?
Yeah, sure. I mean, like your other panelists, I think from what I'm hearing, you're experiencing the same thing as we are, which is there's greater collaboration than I can tell you I've ever seen in my career here in the city. We're a board of trade, so of course, you know, we're very interested in supporting our business community, and right now that means finding new ways to work together with them and government and not-for-profits. And we are a not-for-profit ourselves, of course. We've got a new program, a recovery program we're putting in place that has 6 work tracks, and it's very much a partnership between us and the City of Toronto. It includes all sorts of agencies and associations and many and like literally hundreds of private sector businesses. And I think looking at, how do we survive these kinds of things? How do we reimagine the future to be better at that, and also just for a success and to bring the economy back. But just really specifically one little example, the city recently announced a program, and some of the folks that are hardest hit are the ones with the least deep pockets. And so that's on Main Street, those kind of street, the stores, the restaurants, just the folks that you walk down the road and you pick up something, little hardware stores, all those things. And so the city has developed a program where they're putting some money in and they're bringing in developers and they're working with Shopify and they're getting all these, and they're saying, we will develop in 3 or 5 days or something like that, your website for you so that you can sell through e-commerce, and like this very practical, and that's not usually how city governments and others work. It doesn't tend to be little practical things that actually, they tend to be, we'll discuss it for 5 years and then we'll build it for 3 and then we'll forget what we were doing. And sorry if I'm being a little cynical, but in this case, it's like, it's amazing how we're all coming together to figure out what the really important things are to do and then getting them done and really moving on it.
That's great. Let me just turn to Megan for any final comments on these partnerships, and then we want to go quickly to Q&A. Megan, thoughts?
Just building on what Lee said, there's been a tremendous amount of support for the smaller companies here. These are the ones who are hardest hit. Here in Europe, about 10% of the economy is the hospitality sector, and these are folks who are hit hard. So here in Munich, for example, it actually hasn't been the government. The government provides a tremendous amount of support, but the media actually got together. One of the big newspapers got together and set up an exchange for how people could help the smaller companies, the smaller businesses. So that has been really successful. There's also been an effort to support the agricultural sector here. That's still a big part of the economy. The federal government set up a job exchange database where if you needed labor but you could not get it from another country, you could hire people who had been laid off from other jobs. So there have been successful initiatives to try to pair folks up on the employment side too, because that is a big challenge here in Germany. For some of the lower paid jobs, there's a big dependence on workers coming in from other countries. So I have to say, both on the government side and on the private side, the outpouring of support and the effort to find these innovative solutions has really been very impressive. And here there's also been a large emphasis on supporting the healthcare workers with finding funding for bonuses and feeding the healthcare workers too. That's really been a big focus here as well.
That's wonderful to hear. All right, let me turn it back to Betsy to share a couple questions I know we've gotten from our attendees.
Great, thank you, Gary. I have a question from attendee Adam Bingham. This is a question for Robert, but I think this can be answered by all our panelists as well. Robert asks, what are the key metrics that Ireland specifically is using to measure success for each individual phase of the 5, e.g. infection rates or numbers or GPD? So I think for all of you, what are the key metrics you're looking at for each of those individual phases of reopening? Robert, do you want to start with that?
Yeah, so I mean, I think for us, there's probably 2 ways of looking at this. I think the first one is, of course, is the R rate, and that seems, I didn't know about what an R rate was 8 weeks ago, and now we're looking at the R rate daily to see what it's like. And Ireland now it's down to between 0.4 and 0.6, which is a safe, it's a good place to be in. Not perfect, but a good place to be in. I think also we're looking at the numbers of people in ICU beds. That's a really important metric to get a sense of where the capacity is in the system. And then the other side, actually, it's around the capacity. So I think there's just 2 bits in this. It's measuring what's happening and measuring how the virus itself is evolving. It's also then measuring what the capacity of your own system is to respond to the virus, and that's in contact tracing. It's in your ability to do testing. We've just announced today that we're going to go to 100,000 tests a week with a 3-day turnaround time for those tests, and making sure obviously there's enough capacity in the healthcare system. Speaking of public-private partnerships, one of the things that has happened in this is essentially the private healthcare system in Ireland was brought into the public system in April to increase that capacity. And I think that we'll be very keen the government will be looking intensely at the capacity in our healthcare system and to see if it can cope with the additional cases if they come over the next while.
That's great. Other thoughts from other panelists?
Pretty similar, honestly, from us. Generated, where the number here is to try and stay under 2%. New cases, and so we seem to be there right now and trending that way. So I think some cautious opening that allows us to stick to those kinds of numbers. Again, it was never, we're going to live with this virus for a long time. I think we better all come to a realization of it. But if we can keep it at a manageable, so that at least our healthcare system can handle the really difficult cases. And one of the things that I think is really interesting, if you don't mind me making a quick comment, in some ways, we need to change the narrative now. We need to shift the narrative to one of cautious health, not fear and stay home. And I think that needs, for us in Canada, needs to start right at our Prime Minister, who's every morning has been on television basically saying, oh, everybody needs to stay home and that's how you're going to stay safe. And as we move forward, if we want our economy to survive and recover, we're going to have to start to shift that narrative. It's a really critical piece.
It's all about timing. And Betsy, you have another question?
Yeah, I think we just have time for one more question. I think this is a good one to end on. Obviously, there's been a lot of negative impacts and changes that have come about because of COVID-19, but what opportunities do you see coming out of this global pandemic?
Who wants to take that start?
I'll take it. I think just to the point of Lee's earlier point is that it's made us all realize what's actually really important. And I think a big opportunity for this is for us to reset some of our international relations, for us to realize that, you know, by collaborating more, by collaborating with trusted partners, we can do some great things. And I mean, I hope that there's more collaboration around finding a cure to this pandemic, because I think this is really that is the only way we get back to normal, if we have some kind of a cure for it that makes everyone feel comfortable to go out about their daily business. So when I look at opportunities, I think it is that moment to take stock, to think about where we are in the world, think about who we want to do business with. And as I said, from Ireland's perspective, we hope for a much stronger EU-US relationship coming out of this over the next while.
This is Rachel. I'll add that I think two things, and these are very big picture, but I think they're important to say. One, I think this disease has put this country's inequities in sharp relief, and so I hope that we take the opportunity to recognize that and to really talk about, you know, here in this state, tax reform and homelessness and criminal justice reform and access to healthcare and climate change, and use this as an opportunity to really talk about some of those issues in a way that we haven't before, or talk about them in a way that is more actionable. And then I think the other thing that I have to say on behalf of my public health folks is it has also put in sharp relief how this country has valued public health, and it's really different from state to state, region to region, and we have to we have to fund and support our public health efforts across the country. And so I hope there's an opportunity now to bring some action to both of those things.
Megan, any thoughts in Germany you want to add? And then we'll...
Yeah, I mean, from the transatlantic perspective, I think that this is an opportunity for us to work more closely together across the Atlantic. But one thing that we haven't really touched on is China. I think this is an opportunity for us to work more closely together vis-a-vis China, to ask for, demand really more transparency. We want a China that better respects the international rules of the road. So I think that this is a really big challenge for us. We're seeing some of the risks of global trade. I'm optimistic that we can work together to improve the situation, but I think that we do need to take a close look at our relationship with China and look for a way to improve it so that we can prevent the lack of transparency that we've seen that really started COVID-19 and allowed it to spread early on.
Great, thank you. And Lee, last thoughts?
Yeah, you know, I think I echo everything I've heard, and also I think we talked about the supply chain. I think this is a really amazing opportunity for us to understand. I think we knew we had a global integrated supply chain, and I think we now are learning what the ramifications of that are and what the challenges are that go along with the opportunities it creates. And so I think an opportunity to take a look at that and figure out how it should really work a bit better. The related subject is travel, air travel in particular. Air travel is so integrated. For us now, right now, our border is closed. The longest undefended border in the world is closed between us and the US, but our borders are all closed. No one who isn't Canadian can land here right now. In order for us to survive as an economy, that's got to change. And so how do we do that? So how do we find only other trusted countries that we think we can afford to fly to? And if we fly there, what if they fly somewhere else that we don't trust? So there's a lot of this we need to work out. And I see this as a great opportunity to do it now. And so that in the future, a response to a crisis like this is a lot easier. In Canada, just a quick note, the tourism industry is just devastated. Hotels and so on. In the first 2 weeks, 80% of all people that worked in that industry were laid off. In the first 2 to 3 weeks, they figure, or actually in the time since then, 90% of revenue lost. And that's everything from a little tour operator who takes you on a tour of the, of the harbor or the city on bikes or whatever, right up to Air Canada, who does $20 billion a year. They're literally at a stop. And so this is an opportunity for us to make sure this can never happen again in this way by managing through this crisis.
Let me finish by thanking all of you. I think great discussion, lots of lessons learned, and lots of opportunity going forward. And I think that's a great way to end it. Think about how we continue. We are in a global economy. We've known that for a long time, and we have to, I think, really raise the bar on our focus on international collaboration around these important issues. So thanks to all of you for joining us. Thanks to our panel. Any last words from the Chamber?
No, thank you all so much for joining us, and a special thank you to Dr. Kaplan for joining us as our moderator today. I also want to thank Alaska Airlines for sponsoring this and for Greater Seattle Partners for working with us today. So thanks all for joining us, and have a great Thursday.
Thank you so much.
Thank you very much. Cheers.
Best to you all.
Thank you.
All right, bye-bye.